I'm Joe Desavo. I'm a senior. I did my project on myocardial infarction, which is a heart attack. So what it is basically is if you have a blood vessel that's narrowed or the blood flow is blocked by either plaque, or if the plaque has a tear, it might form a blood clot around it. And if the blood flow is blocked, unfortunately, the heart will die. So symptoms of this include chest pain, shortness of breath, discomfort in the upper body, like the arm or something, and nausea. Unfortunately, sometimes you might not have symptoms, and that's called a silent heart attack. But if you feel those symptoms, you should go to a doctor. And the diagnosis, to diagnose you, they will get either an electrocardiogram, which looks for heart damage, or they could go to a coronary angiography, which uses dye and X-ray to check your heart. And if you each year over 1 million people in the U.S. have a heart attack, and about half of them die. 2/3 of women who have a heart attack fail to make a full recovery. So treatment includes angioplasty, which they go in with. It's kind of like a balloon, and it inflates to scrape away the clot. And they might place a stent, it's like a metal tube to open up the vessel. Or they might have thrombolytic therapy, which is drugs, or open heart surgery, which is an extreme. Risk factors include age, gender, and genes, which you can't control, but you can control not smoking, eating healthy, staying away from fats and salts, and exercising 30 minutes a day. Are there any questions?
You said that half of everybody dies. That's a heart attack, right?
Yes.
And you said 2/3 or 1/3 of women?
Yeah, 2/3 of women that get it make a full recovery. Only 2/3 fail to make a full recovery. So women, women don't usually recuperate.
Why is that?
Well, he just said recuperate fully, he's saying.
Yeah, fully.
So, that doesn't mean, they can recuperate. They just might not be at the same place they were before.
So that means, not making a full, that means they're getting slower?
Yeah, they might not be able to exercise or things like that. It depends.
Yeah, it doesn't necessarily mean, mentally slow. It depends on what it
Is that
affects.
the heart can't function not well anymore?
Yeah, basically.
Yeah, but it also depends how severe it was. There's different, levels of severity. Yeah.
Now, when you have a heart attack, you grab your arm, right?
Oh, it depends. So you might have a silent heart attack, but yeah, it feels like you have a pressure in your heart or maybe your arm. Everyone's different. Sometimes, like I said, you might not even feel any symptoms and you just have a heart attack.
Could it be the left arm? Because they say it's supposed to be connected to the heart, the ring finger.
I guess. And I chose this because my grandfather died of a heart attack, and my other grandfather has stents in his coronary artery.
Stroke is a heart attack?
Stroke? No.
You could have two different types of things you learned about. Oh, right! You learned here. You could have a hemorrhagic bleed on the brain, or it's a clot, and then you don't get blood flow to it, so all right, let's. Great job.